We all know that neuropsychiatric symptoms, even though they are not included in the diagnostic criteria, in the diagnostic guidelines for dementia or for mild cognitive impairment, they are present. The neuropsychiatric symptoms are present in more than 90% of individuals with dementia in a stage of the syndrome course. So they are really common. And depression is one of the most common neuropsychiatric symptoms with a prevalence of higher than 40%. We have also to take into consideration that according to the literature, the neuropsychiatric symptoms have an enormous impact on the quality of life of both the care partners and the patients and the people with dementia. And they are a real driver in not only the quality of life but also of care partners, but also of care partner burden. You know, care partners are significantly more affected by neuropsychiatric symptoms like delusions, like apathy, like aggression, like depression, compared to difficulties of the patient with memory, with orientation, or with executive functions. According to our findings, a brief tool for capturing depression, like the Geriatric Depression Scale, is in the position with relatively high accuracy to differentiate between individuals with cognitive decline and those without cognitive decline. One of the shortcomings of our findings, of our study actually, is that the method, the machine learning techniques, and the findings of the method have a very high specificity, but a relatively low sensitivity. Meaning that in our case, we do have only a few incorrectly positive results, which means that if somebody, based on the Geriatric Depression Scale findings, scores positively for the presence of cognitive decline, then it is very possible that the person suffers from either mild cognitive impairment or dementia. And if a patient, if an examinee comes with such a finding, goes with such a finding to the clinician, then the clinician has something in his or her hands, a solid basis actually, on which he or she can work further for establishing a diagnosis.